Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on complement pathways under the section of Immunology. So what is a complement? It is a plasma protein cascade that leads to formation of membrane attack complex, or MAC. It's really quite similar to the clotting cascade. So this topic is going to be run quite differently compared to our usual topics, where we would be discussing the signs and symptoms and clinical presentation and investigations, because the key for complement pathway really to understand the process that leads to activation of MAC and how it's potentially relevant in clinical use, which we will be discussing later on. So just to provide you with an overview, MAC is used by the immune system to destroy invading pathogens. It does this by puncturing the cell wall membrane. Complement can be activated by one of the three pathways. These include classic, alternate, and lectin binding pathways. So I'm sure all of you remember this from your medical school days. This is something that a lot of clinicians and medical students struggle with understanding it, but it's really quite similar to your clotting cascades in the way that one factor is going to act on another, which will activate it. And then that, as a result of it, will activate the next factor, sort of having sequential events. But if you were to dumb it down and make it really quite simple, essentially, as I mentioned, you've got three pathways. One is an alternative pathway, which is particularly important for apoptotic tissue or pathogens. One is a classical pathway, which is antigen-antibody complex driven. And the last one is a lectin pathway, which is when plasma lectin binds to mannose on the pathogens. These all work on C3, and C3 then gets converted to C5. And C5, which is the complement 5, then gets converted and produce C5b, C6, C7, C8, and C9n, as well as C5b to 9 complexes. And depending on where in this pathway you have deficiency or whichever illness affects which part of the pathway, you would have problems with specific things, such as potentially diseases that are antibody and antigen driven, or diseases that are as a result of apoptotic tissue or pathogens, or diseases that are related to the polysaccharide capsules of antigens. We'll be discussing this in later slides, so hopefully make more sense. But you do need to have a good memory and understanding of how this pathway works. So if you were to discuss pathway activation, frequently infections can trigger complement pathways, and the classic pathway is the only pathway that requires antibodies for activation. So, as we discussed previously, the classic pathway is IgG or IgM mediated, and that's your antibodies. Your alternate pathway is activated by the microbe surface molecules, and your lectin pathway is activated by the mannose or other polysaccharide components on the microbial surface. As I previously discussed, following positive feedback loops, active complement regulatory products are made, which basically have three main jobs or effects. Number one is opsonisation, which primarily involves the C3b complement. Number two is chemotaxis and inflammation, which primarily involves C3A, C4A, C5A, which are responsible, for instance, in the case of anaphylaxis, and C5A, which is the only one for neutrophil chemotaxis. Finally, the other main effect of this pathway activation is cell lysis, which is done through MAC, and primarily complement C5b to 9 are responsible for that. So let's talk about these individually. Opsonisation is essentially derived from the Greek word, which is preparing to eat. And in opsonisation, C3b and IgG are primarily opsonins in bacterial defense, which is frequently led to enhanced phagocytosis. C3b also helps with clearing other immune complexes. Now let's talk about the inhibitors of the pathway. These include decay accelerating factor, or DAF for sure. The other name for this is CD55, and the other one is C1 esterase inhibitor. These two both help to prevent complement activation on self cells. You are probably more familiar with C1 esterase inhibitor from a disease called C1 inhibitor deficiency, which we are going to be talking about in one of our future videos. Now, let's have a think about the use of complement pathway in clinical practice, which is probably the most important slide in here, and it's also important for your day-to-day clinical work. So frequently, the measurement of C3 and C4 are used to detect disease activity in disorders in which complement activation is needed. The classic example of this is going to be in the case of systemic lupus erythematosus. Other examples include chronic infections such as endocarditis or mesangiocapillary glomerulonephritis. The other point is that the final common pathway deficiencies can result in recurrent Neisseria species infections. And the test that we use to assess the function of the classic pathway is CH50. So that's something that is used both clinically as well as for the purpose of MRCP. Now, let's do some questions. Question 1. Which of the following statement accurately describes the alternative pathway of the complement system? A. It's primarily initiated by antigen-antibody complexes. B. It is involved in the opsonization of pathogens. C. It requires the presence of antibodies for activation. D. It is independent of antibodies and can be activated directly by microbial surfaces. E. It leads to the formation of the membrane attack complex, or MAC, only. So now the correct answer in here is option D, which is that it is independent of antibodies and can be activated directly by microbial surfaces. Recall that it is a classic pathway that has any effects on antibodies or antigens, and the alternative pathway is indeed directed by microbial surfaces. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.